Happy midday. Isn't lunch wonderful? My name is Rose Bailey, and I'm part of the West Tennessee Healthcare team. Today, I'm here to introduce Dr. Elly Riley. Dr. Riley is a family physician with West Tennessee Healthcare, UT Madison, where she has worked since 2013, teaching family medicine residents and medical students in addition to seeing patients. Originally from Ohio, she relocated to Tennessee and attended college at UT Martin. Then went on to medical school at Kansas City University. Dr. Riley completed her family medicine residency at Doctors Hospital in Columbus, Ohio. Dr. Riley received the Building Strong Brains training and certification to be a community educator on adverse childhood experiences, or ACEs as we call them. She uses the training she has received as well as her experience as a medical provider to speak to the Jackson community about ACEs and the impact they have on the well-being of our community. She also teaches residents in her supervision about trauma-informed care, ACEs, and building resiliency in children and families. Dr. Riley is married with 3 children. She enjoys concerts, hiking, yoga, attempts at gardening, and embarrassing her children. Please give a warm welcome to Dr. Riley.
Thank y'all. Thank you, Ms. Bailey. Glad to be here. Admittedly, I'll just start by saying I'm a little nervous. So it's unusual, too, for me not to have this in front of me. So hopefully this all works out. So you may be saying, well, I thought the agenda said that we were going to be talking about ACEs, and this says brain development. She's about to talk to me about brain development. I am, because it's important for me to kind of introduce brain development and laying the foundation of neurodevelopment to understand why ACEs is so impactful for our health, but also for our community. So Building Strong Brains Tennessee is a public-private partnership in the state of Tennessee, and the cultural mission really is to spread the word, to educate, so that we can change our policies around creating new policies so that we can help mitigate the adverse effects of ACEs. So healthy child development is really the foundation on which these 4 pillars of educational achievement, economic productivity, responsible citizenship, and lifelong health are built in children and individuals. And those are really the pillars for successful parenting of the next generation. If we can instill those pillars in our children, then they will go on to be parents that will be lifelong citizens of productive communities and a healthy economy. And this is not just opinion. This is really based on multiple sciences, the social sciences, neurodevelopment, even financial and economic evaluations. So today we're going to review 4 concepts of development. Brain architecture, which is established early in life and really even prenatally as infants are in the womb. And they help to support lifelong learning, behavior, and health. Stable, caring relationships and the serve and return interactions that help shape brain architecture. Toxic stress, which happens in the early years of life, if it happens in the early years rather, it can really derail neurodevelopment. And how we can promote resilience, building that through serve and return relationships, which helps improve those self-regulation skills that are so important to help individuals develop executive functioning skills. There are really sensitive periods of brain development, and that's why we talk about childhood so much throughout this, but adolescence is another critical part where brain development is occurring, and as you guys all know, we can learn, and our brains can develop all through adulthood as well, so it can be strengthened at any age, but is best strengthened early in life, early childhood, and in adolescence. So first we're going to touch on brain architecture and building a strong foundation for the brain. I think I'm going to skip these videos. These are excellent videos, but for the sake of time, we're going to skip them. But please know that all of these videos are available on the Building Strong Brains website and on Google and YouTube, and they will help if this is an interesting topic to you or you want to learn more. I would strongly encourage referencing those. So brain architecture supports lifelong learning, behavior, and health. And they're built over time. You can think about the brain as the foundation of a house. So hopefully nobody's building a house right now because I heard it's fairly stressful these days. But you think about how you build a foundation. Do you build it on gravel? What do you build it on, a foundation of a house? Concrete, they tell me. Yeah, because it has to be stable. And if you built a house on gravel, let's say, then there would be risk that it would be unstable. Every person, too, that's building a house has its own role. So there's electricians, there's plumbers, there's carpenters, and they all play a critical role in making sure that everything comes together nicely, the seams fit together, the roof doesn't leak, and the house doesn't fall down. And brain architecture is very similar to that. It has to be built from the bottom up with many different players key to making sure that it's sturdy. The brain is fascinating. It creates new neurons and new neural synapses by the second, millions by the second. And so the newborn really has very little neurons, but 85% of the brain growth is completed by the age of 3, 85% by age 3. So critical that the right connections are made and the right connections are reinforced again and again and again, because the brain is so fascinating, it actually prunes away those things that it doesn't use all of the time. And so if a child is experiencing positive serve and return interactions, these positive back and forth that we know help make good neuron connections, and those things are happening over and over and over again, then the brain is reinforcing those connections to encourage basically similar interactions. But if the child and the opposite is having negative interactions, if they're experiencing negative things, harmful things, abuse, neglect, those are the types of neurons that are getting reinforced, and the positive things are getting pruned away. And so you're building this almost really negative foundation for early in life. So serve and return interactions help to shape that brain circuitry, and you can think about, I'm going to go, it doesn't want me to advance past that slide. So you could think about serve and return as a volleyball game or a tennis or a ping pong. That beautiful sound that the tennis ball makes as you hit it back and forth across. And that's really what you want in a tennis game, right? You want that volley back and forth again and again. And kids need that actually to develop strong neuron connections and to build positive foundations for their brain. They actually need that to thrive and to build on throughout their lifetime. So examples, I'm going to try it again. So examples of serve and return would be an infant looking at their parent or their caregiver and smiling, and the caregiver smiling back. I have a almost 18-month-old now, and one of my favorite parts of early childhood development happens around 4 months or 6 months of age, where you smile at the baby and they smile back at you. My oldest is now 10, and I tell people that I loved her before she smiled at me, but I really didn't fall in love with her until she started smiling back at me. That's my favorite time, when they start smiling back. But every time you smile at a child who's smiling at you, you are actually reinforcing positive connections. Then they start to babble and coo, and you cooing back at them or babbling back at them, again, helps reinforce these positive interactions. So those are things that kids need over and over and over again, and as they are growing and changing and developing new skills, those skills, again, need to be reinforced by the adults in their lives and the people that are surround them. And it may not just be the parents in the family, right? If you think about other people who are able to offer positive serve and return interactions, it's going to be our early child care educators, those in preschools, grandparents, neighbors, church staff, family friends, grandmothers, so many people that are a part of those positive back and forth serve and return interactions help to build a very strong foundation for those children so that they can build skills on top of skills. You want me to try it? Oh, don't try it. Sorry, I'll just put it down. So when children don't have those positive back and forth serve and return interactions, again, they're not able to make those strong neural connections, and there's just a little bit of a shakier foundation, and they're not able to build strong, positive skills on top of that foundation. I'm trying to remember from memory what I should talk about next. I can move forward, but don't go back. Can you go back? Okay. That's okay. That's right. We are doing serve and return right now. You are learning, which is great because we can learn as adults, not as well as we can when we're kids, but we can still learn. Okay, so toxic stress, well, all of us are in stress every day, right? Whether it's getting to a speech late or standing up in front of a group of strangers. In response to me standing up here, it's a little bit of stress, and my body responds to that stress. My heart rate goes up, my blood pressure might go up a little bit, my body is starting to release some cytokines and some hormones and some chemicals that our bodies make in response to stress. That is a part of our human development. We are fight or flight, okay? And so that's part of that process that's happening. So that's kind of a normal stress situation. My heart rate goes up, my blood pressure goes up, but it can come down again. So if that's constantly, though, what's happening to you on a daily basis because you're being exposed to physical abuse or emotional abuse or verbal abuse, or you're witnessing violence, or your parent is very unstable because they're addicted to a drug or a substance, or your parents are stressed because something that they experienced when they were children, all of these things coming at a child constantly creates this constant stress level, very, very high. And over time, we know that a constant stress level elevated changes our brains. It actually changes our neurodevelopment. And again, like I said, it prunes away those positive things in our brain, those positive neurons, and reinforces the negative. Toxic stress really happens when all those things are happening at kids over and over again, but they don't have a supportive adult in their life to provide a stable, caring, nurturing relationship, because they really need that to buffer the stress. They need that to say, I can turn and smile at this person and they will smile back at me. Even though something over here might be ugly and scary, I can turn to them and get reinforced that things are okay, that somebody loves me. But also that they can, as they grow and they're able to communicate, that they can bounce off some of these stressful things off somebody else and talk through and try to figure out how to deal with it, how to cope, and build resilience through those strong relationships, even if they are going through high levels of tolerable stress. So toxic stress, again, is really the pairing of the stressful situation with the lack of a strong, nurturing, stable relationship in their life. And over time, that toxic stress changes the brain development. And it becomes this perpetual pattern. And the last thing that you were maybe able to see was the intergenerational transmission of toxic stress. So if a parent grows up in an environment where they're dealing with intolerable levels of stress without a parent there, their physiology changes. They are constantly in that fight or flight feeling. And when they have a child then when that parent has a child who is maybe a new parent, maybe has lack of support in their life, and they have an infant then who's now crying at them, and the parent doesn't know how to deal with that, doesn't know how to cope with that, they may turn to some dysregulatory behaviors or some inappropriate behaviors. They may turn away from their infant and lack the ability to provide that back and forth serve and return that infant needs so much. And so it just kind of perpetuates itself. Okay, so we've talked about brain foundation. We've talked about serve and return. We've talked a little bit about toxic stress. which finally leads me to ACEs. So ACEs stands for Adverse Childhood Experiences, and there was an original ACEs study. Great. So this is just the body's response to different types of stress. So I talked briefly about a positive stress, and a child's example of a positive stress might be they come in for a vaccine. They get really stressed out, their heart rate goes up, their blood pressure goes up, but they're able to calm back down after that vaccine. A test is another example of a positive stress. Tolerable stress we've all experienced too. Loss of a loved one is an example, or a broken bone. It maybe keeps you stressed for a little bit longer, but again, over time, that stress goes away and the body is able to readjust physiologically. But toxic stress, again, is prolonged periods of adversity with the lack of a strong, caring, stable, nurturing adult in their lives. Great. So, neuroscience tells us, and this is just to depict what I've said, but neuroscience tells us that these toxic stress situations change the development. What you're looking at here are two side-by-side PET scans of two different 3-year-old children. And the one on the left is that of what we're calling a healthy child, a child that grew up typically developing in a positive, caring environment. The one on the right is that of a child who grew up in a Romanian orphanage in the 1990s, was placed in this Romanian orphanage shortly after birth. And in the 90s, Romanian orphanages were not very well monitored or controlled. They were overstaffed, they were crowded. The staffing didn't have very good education on child development or nurturing behaviors. And as such, children in the 90s in these Romanian orphanages were really not, I hate to use the word neglect, but they were not provided that serve and return that they so desperately needed. So in the PET scan, you can actually see there's a huge difference here. And I am no neuroscientist, neurologist, I am a family doctor, but I can see that clearly the colors are different on the left versus the right. And they've highlighted the temporal lobes, which is an important part of the brain to regulate emotions and receive input from the senses. On the bottom right is the legend that tells you that red and yellow are more active parts of the brain, and the blue and black are the least active. So there's just not a whole lot of activity in the temporal lobes of this child because it really hasn't learned to regulate its senses and its emotions because it hasn't been exposed to senses and emotions as well as the other healthy child. So toxic stress does alter brain development in different parts of the brain. The amygdala, which activates the stress response, the prefrontal cortex, again, leading to loss of those positive neurons that we need, and then the hippocampus, which helps us really understand and cope with our emotions. So multiple parts of the brain are affected by toxic stress. You can think of the brain, in a specific part of the brain, as the air traffic control system in the brain, and it really helps us deal with executive functioning. How am I doing on time? And that's really, executive functioning is how we go about our daily lives as adolescents and adults, how we get to places on time and pay our bills and have positive relationships with others in our lives. If our executive functioning skills really are not built on a strong foundation, then everything kind of falls apart anytime we get the littlest piece of stress just shoved at us. Is it possible to go to that video that somehow got skipped over? I'm sorry, I know I'm asking a whole lot. I appreciate you guys. If it will work immediately, great, and if not, we'll just move on. This is just a nice summary of kind of everything that I've said to date. And that's okay if it won't. You guys will just have to have some homework, some videos that I really, okay, great. Okay, that's okay. We'll just go on to ACEs. So I think I started to tell you, in the 90s, Kaiser Permanente, which is a large health entity out in California, not only do they provide health services, but they also have an insurance component. So Kaiser Permanente, along with the CDC together, said, we want to look at some experiences that people have in childhood, some negative experiences, and see, does that correlate at all with health outcomes later in life? And so they had at their fingertips this very large amount of members in their group, patients, 17,000, which is a huge number for a study. And they gave 17,000 of their members, adults, this 10-question questionnaire that basically asked them, have you experienced certain things in your childhood? And they had to answer yes or no. And then at the end of that, they got a score from 0 to 10 based on how many yeses they had. And just to let you know, the 17,000 people that they polled, they were not a really very diverse set of the population. You can see that most of them had at least some college. Most of them were white, 75% of them are white. And these were people that were over the age of 40, predominantly recalling things that happened to them as a child. And the outcome of the ACEs study back in the 90s was really astounding. They asked them about the participants about physical, emotional, and sexual abuse, asked them about physical and emotional neglect, and then whether they experienced mental illness in a parent, incarcerated relative, if they witnessed their mother being treated violently, if they had a parent with substance abuse, and whether there was divorced parents. And a lot of people, as you can see, the numbers here, maybe doesn't surprise you that they're high. I don't know that that's really the shocking thing of this study. What is a little bit more interesting, though, is that many people experienced multiple ACEs. And 1 in 4 people experienced at least 4 ACEs. And 4 ACEs seems to be the tipping point in terms of what happens to us in terms of our health later in life. So ACEs seems to have lasting effects on our health, on our behavior, and also on our potential to get a good job, to maintain that job, to graduate from high school and college, to have successful marital relationships. And the more ACEs you have, the more likely you are to have negative effects on your health and productivity.
What does your parents' divorce have to do with your risk for heart disease? If your mother had a drinking problem when you were growing up, are you more likely to suffer from depression as an adult? Here's what you should know about ACEs. ACEs stand for Adverse Childhood Experiences, extremely stressful events that can happen to a child growing up. Some experiences are so stressful that they can alter brain development, as well as the immune system, increasing the risk of lifelong health and social problems in adulthood. The term comes from the Adverse Childhood Experiences Study, landmark research that shed new light on the root cause of everything from stroke and liver disease to substance abuse and mental illness. In the late 1990s, an epidemiologist from the Centers for Disease Control and a preventive medicine doctor at Kaiser Permanente set out to understand the association between childhood experience and lifelong health. They asked over 17,000 people in the Kaiser Health Plan in San Diego about their health history, as well as difficult questions about their experiences growing up. Anda and Felitti tallied up 10 different kinds of adversity in this largely middle-class and college-educated population. They were stunned to see how common ACEs were. 21% of all respondents were sexually abused as children. 19% grew up with someone who suffered mental illness. 28% had been physically abused. And 2 out of 3 respondents had experienced at least one ACE. The researchers next looked at how someone's ACE score, or the number of adversities they experienced, related to a wide array of serious health and social problems. They saw that the more ACEs someone had, the greater their risk for poor outcomes compared with someone with no ACEs. Someone with an ACE score of 4 had twice the risk of heart disease and cancer. Someone with an ACE score of 5 had an 8 times greater chance of being an alcoholic. And those with an ACE score of 6 or more, on average, died 20 years earlier. With every major problem they looked at in the ACE study, the risk went up for each additional adverse experience in childhood. As Dr. Robert Anda says, what's predictable is preventable. It's important to remember that ACEs are not destiny. ACEs are a tool for understanding the health of a population as a whole. For individuals, an ACE score can be a tool for understanding their own risk for health and social problems and empower them to make changes for themselves and their children. ACEs tend to get passed down from generation to generation and are common across all income levels, races, and cultures. But increasingly, people of all different professions and backgrounds are coming together to discuss how ACEs affect their communities. They're finding new ways to treat and prevent ACEs. Many doctors are starting to screen their patients for ACEs as part of their medical history. More schools are becoming trauma-informed, considering the source of problem behavior when disciplining their students, instead of immediately suspending or expelling them. To learn more about interrupting the cycle of adversity and improving health and well-being for the next generation, please visit kpjrfilms.co.
So the first time I heard about ACEs actually was well into my practice. I did not learn about it in medical school. I did not learn about it in residency. Many of you may already know about ACEs, and many of you may be hearing it for the first time. But I remember the first time thinking, oh my gosh, this is so awful and so life-changing and so depressing. But there is hope because we can do something about it. I'm going to skip through some of this just for the sake of time, but since the initial ACEs study, they have expanded and added some additional adverse childhood experiences that we know change neurodevelopment and that we know impact the ability for the brain to build a strong foundation. So what can we do about it? We can promote resilience, not only in our children, but in the adult caregivers that are impacting their brain development. And we do this through community partnerships, community programs, by supporting those adults. I'm going to skip this one. And increase a child's positive outcome or positive experiences, because we know that positive experiences, things like feeling supported in their community and at home, feeling like they belonged in high school, extracurricular activities, but then also that they have access to childcare and that they have other positive nurturing relationships in their lives. Those things we know foster resilience and help, if you think of this as a fulcrum, move that fulcrum, because all of us have negative experiences, but we want the positive experiences to outweigh those negative experiences. So we can do that as a community by ensuring that every child's relationships are safe, from physical and emotional harm, are stable and that they have familiar routines, people, and places in their lives, and that they're nurturing. So programs like home visiting programs have been shown to improve outcomes, both in children and in the families that help support those children. Sorry. Resiliency, yes. I'm trying to remember by brain. There are a few other. Are you easier to advance than me, maybe? Nope? Okay. I would like to get to the tree, because the tree is a nice visual to explain that if you think about ACEs as the leaves of a tree, things that children are going to experience, we can maybe not necessarily eliminate their experience. We may not be able to fix their parents' addiction or fix the emotional abuse that they are experiencing. We can try, though, through support. So we can try to provide mental health services for those parents, and we can screen the mothers for postpartum depression and offer counseling services and support services around that. But it's not just treating the actual ACE itself. If they're also experiencing adverse community environments like poverty, discrimination, a lack of opportunity, economic mobility, social capital, if they have poor housing, if they're experiencing violence, those are things that we as a community actually do have a say in, and we do have our hands and feet. All of you people in this room, I know, have different aspects of that at your fingertips. So thinking around children's health care, thinking around public health systems, child welfare systems, adult mental health, substance abuse services, EMS systems, making sure that if there is an emergency, they get there timely, children's behavioral health services, trauma-informed schools, criminal justice systems that focus on improving and impairing, early childhood systems, so strengthening our early interventions and our home visiting programs, making our schools as strong and vital as they possibly can be. And all of that can come through things like public housing, continuing education, employment services, community policing, and advising policy. So really shifting this norm from what is wrong with you to what has happened to you. I am certainly guilty of asking that first question, sometimes of my kids. But really, like, what has happened to you? What things in your history got you to this point where this is your response to a stressful situation? I promise you that almost 100% of the time, there is more of a story there. And we may not be able to fix that happened to them, right? But trying to support them and help them cope and help them grow this next generation so that the future generation of people sitting in this room is not experiencing a similar level of ACEs. Thank you.